Hello, I'm Dr. Terry Hess. Welcome to our patient education series. This video will teach you about the condition known as plantar fasciitis, also referred to as heel spur syndrome, or more commonly known to the general public simply as heel pain. The purpose of this educational session is to reiterate the information received during your visit with our physicians at Foot and Ankle Surgical Associates, or if you've not yet been seen by one of our doctors, this video will be an opportunity to learn more about the pain you may be experiencing and what we can do here to help cure it for you.
The plantar fascia is a band of ligamentous tissue that attaches the full length of your foot from your heel to your toes. It is in essence the bridging piece of tissue that helps to create the arch of your foot by holding the heel and forefoot in proximity, allowing for the best mechanical support. Plantar fasciitis is an inflammation of the plantar fascia. Over time, this inflammation causes the plantar fascia to try to pull away from the heel bone. In order to remain attached, the bone, sensing the pull, will grow to compensate. This growth shows up on a radiograph as a heel spur. It is important to know that despite what some people may think, or you may have heard, the heel spur is not the source of your pain. The inflamed tissues are the reason for pain. The heel spur is merely the effect of the cause, which is an inflamed plantar fascia. Many factors contribute to this inflammation, such as hard work surfaces, constant standing on cement, genetics, tight calf muscles, and multiple other concerns we experience every day. Ultimately, the cause of the pain occurs when the mechanical stability of the foot is compromised. All of these factors may lead to the most common findings in the patients with plantar fasciitis, and that is shortened or tightened calf muscles. When the calf muscles, the gastrocnemius and soleus, become shortened or contracted, they cause the foot to plantar flex, or point downward. When standing, this translates to a raising of the heel from the ground, or toe walking. With continued walking and contracted calf muscles, your foot undergoes a constant spring stretch, causing micro-injury and tearing to occur at the attachment of the plantar fascia at the heel. Most commonly, this tearing occurs at the ligamentous insertions, and most commonly it is the most inside or medial slip of the plantar fascia. It is possible to experience pain on direct bottom of the heel and outside of the heel as well. It is this micro-tearing that causes the extreme pain you may be experiencing in your heel. The most common finding when talking about plantar fasciitis is pain in the heel that occurs when you have been seated for any period of time and then stand and begin to walk again. It is common for the first step out of bed in the morning to be the most painful step. This is due to the micro tears becoming re-injured with each step you take. The good news is we can help. Our physicians will evaluate your foot by doing an ultrasound study. Sound waves are projected into the tissue of your foot, and as they reach structures, they bounce back to the wand. The rate and time at which they return allows the machine to create a three-dimensional picture of the inside of your foot. This allows our physicians to see exactly how thickened and inflamed your plantar fascia is. Dependent upon the severity of your symptoms and the thickness of your plantar fascia, the doctors will discuss with you the different treatment options. Usually, the thickness of the plantar fascia requires the use of a cortisone injection to help calm it down. The way cortisone works, in this case, is to help kickstart the body's intrinsic mechanisms to clean up the inflammation. They've proven quite effective in relieving and chasing away the symptoms of plantar fasciitis. More important for you is the care you take at home if you have plantar fasciitis. That is why we created a home treatment plan designed specifically to eliminate the symptoms and signs of plantar fasciitis. The first piece of care plan is to fix the problem of the foot instability. As mentioned before, something has occurred to compromise the architecture of your foot. To help fix this problem, we send you home with a pair of prefabricated insoles, or orthotics. The purpose of these is to place your foot back in a more mechanically aligned position and take the added strain off the plantar fascia. Ultimately, you will need to be fitted for a pair of custom orthotics. Custom orthotics have been molded specifically and tailored perfectly to your foot type and your individual feet. Even if the concern is only one foot, both feet must be fitted for orthotics in order to maintain an even dispersal of weight over your joints. Many insurance companies will cover these devices, and they are ultimately the solution to most of the problems associated with plantar fasciitis. Whether you've received a pair of prefabricated orthotics or custom orthotics, you will need to begin slowly at wearing them. Even if you feel great wearing them right off the bat, you'll need to break them in slowly. The reason for a break-in period is that they will not only change the mechanical alignment of your feet, but this will translate to slight changes in the angles of the joints of your ankles, knees, and even your back and hips. Though this change will be slight, it may cause you to feel sore if you were to break these orthotics in too quickly and begin wearing them all day from the beginning. The break-in is simply an 8-day break-in. For the first day, wear them only 1 hour, and then add 1 hour each day until you've arrived at 8 hours or 8 days. This will ensure your body gets used to a slow adjustment in the positioning. The second part of the home care plan is icing. Ice has been known for its anti-inflammatory properties, and that is why we ask you to ice your area of concern, the heel, for 7 minutes twice a day. There are 2 methods we recommend for this. The first is to buy small paper Dixie cups and fill them with water and place them in the freezer. When frozen, you can peel down the paper sides and use them to ice the area in circular motions. Make sure to add some pressure, as gentle massage can do wonders at running out inflammation. The other method for icing is to take a 20-ounce soda. Drink it, of course. With the empty bottle, fill it with water. Place this bottle with the cap on it in the freezer until it's frozen. When you take it out, place it on the floor with the arch of your foot, step onto the frozen bottle, and gently roll your arch and heel up and down the bottle, making sure to apply direct pressure as gentle rolling massage for 7 minutes, 2 times a day. The third piece of your home care is to stretch the foot and calf. Remember, much of the problem caused by the foot instability of plantar fasciitis is made worse by a tight calf, allowing for decreased range of motion in the ankle and foot. There are many different types of calf stretches you can do. The desired time is to stretch each side 10 to 30 seconds at a time and alternate for 10 minutes twice a day. Now, this seems like a long time to spend stretching. However, it's a crucial piece of relieving the symptoms and problem caused by plantar fasciitis. I will now demonstrate 2 different techniques for stretching your calves. The first technique requires some control and upper body strength, as well as a wall. This technique allows you to stretch both calves at the same time, or one at a time as you feel comfortable. Place your feet at shoulder length apart. You'll need to stand about 2 to 3 feet away from the wall in order to get the appropriate stretch, and you will then reach with your hands and lean forward to the wall. As you make contact with the wall, use your arms to adjust the lean angle until you feel a tight stretch in your calf muscles. You should not feel pain. If it hurts, you're stretching too far, too fast. You should merely feel a tightness and a sensation of pulling. Hold this position for 1 to 3 minutes, and then release. Repeat until you've reached 10 minutes. If you don't have time for 10 minutes at one time, you may choose to break the stretch up, as long as you've stretched 10 minutes once a day. This technique may also be used as a single leg stretch. You would modify by setting up the same way, legs shoulder length apart and 2 or 3 feet away from the wall. Instead of leaning in with just your hands, you will place one leg, the leg that you are not stretching, forward in a lunge position, as shown here. You will then bend at the leg, making sure the heel of the straight leg stays on the ground and your hips move forward parallel to the ground. Lunge forward until you feel a good stretch in the straight leg and hold this for 30 to 90 seconds. You will then switch legs and stretch the opposite leg. Because you are only stretching one leg at a time, the total time should equal 20 minutes. The second technique is one that requires a step or set of stairs. To do this stretch, place the ball of your foot at the edge of the step and allow your body weight to fall through your heels, dropping them. This will induce a nice stretch on your calves. Again, do this a total of 10 minutes per day. This should not be painful again. If it is, you're stretching too much too quickly. By seeing our physicians for diagnosis and following the suggested treatment and home care plan, you will be able to run plantar fasciitis as well as all of its pain away and have a healthy, happy foot.